I am Dr. Aditya Gupta. I am the Chief Neurosurgeon at Artemis Hospitals in Gurgaon. Now, in neurosurgery at Artemis, we provide a huge spectrum of services to our patients. We cover all aspects of brain and spine surgery. To give you a snapshot of the kinds of interesting things and exciting things that we do, which make a huge difference to the patient's life. So I'll start with an example of what we call as navigation-guided microsurgery. So for most of the kinds of brain tumors, we are operating them through a very small incision guided by a technology called navigation, which makes the surgery incision very small and located at the appropriate place to access the tumor. Now, patients who have this kind of minimal access surgery with us do have a very good post-operative outcome, and they have a very high level of post-operative comfort. And typically, we discharge all these patients on the third post-op day in the morning itself. A second thing which I would like to highlight here is endoscopic neurosurgery. So we do a full range of procedure to target the skull-based tumors through endoscopy, which is typically carried out through the nose. And we also do ventricular endoscopy, so which is guided to removing tumors and lesions which are located in the ventricles, which are basically water cavities inside the brain. Third thing which I would like to highlight is a technique called cyberknife radiosurgery, which is completely non-invasive. And in 40 minutes, we are able to cure and treat a patient with a small brain tumor without any cut, without any pain, and without any risk. So the remarkable thing is that these patients come to us in the morning, and after a 40-minute treatment, they go back home the same day. Which I would say is a boon for international patients who travel to us from far. And for them, this kind of a very comfortable and safe treatment would actually be a very, very rewarding one for them and their families. Apart from this, we do some very interesting work called deep brain stimulation. So patients with Parkinson's disease and epilepsy of special kind, we put deep brain stimulating electrodes in particular parts of the brain, and these are then joined to a pacemaker. So this is the procedure which is called as deep brain stimulation. And as I said, the commonest patients that we treat with this technology are Parkinson's disease patients. Finally, I would like to say that we do a full range of spine surgery, which includes not only spinal fusions and disc surgery, but also removing tumors from within and outside of the spinal cord. So we do a complete spectrum of procedures as far as neurosurgery is concerned. We even treat patients with aneurysms and AVMs, which are basically arising from the blood vessels of the brain. And we also do treat any injuries of the nerves. For example, brachial plexus injuries and nerve injuries are also something that we treat. So we would be very happy to help you should the need arise. And to get in touch with us, you can contact us through cureindia.com.
Если вы заинтересованы в лечении в Индии, пожалуйста, подпишитесь на наш канал. Нажмите на значок колокольчика, чтобы никогда не пропустить новые видео от нас.